I've always been fascinated with the brain, so I think that's what led me to the neuro area. But then in terms of surgery, growing up I always liked to do things with my hands, and my dad, I had two brothers, and my dad always pretty much treated the three of us just as his little helpers when doing whatever construction work around the house or around building tree houses and stuff. So I always did a lot of things with my hands, and I think I really liked that aspect. And so I think it just was a perfect complement for me, wanting to go into medicine to do both the neuro and the surgical part, the actual doing of things in medicine. With pediatric brain tumors, we definitely take a team approach. All these team members get together to help decide what the best next steps are in the treatment of these patients. My job is to address their concerns, take the best care of their child, and hopefully reassure them, that regardless of what it is that we need to do, that we'll take the best care of them that we need to. And so the reason for that first visit is really to help establish a plan that we're all comfortable with, and whatever that plan be, make sure it's clear moving forward. So by the time they leave here, hopefully they're comfortable that we're taking, the appropriate next steps in the care of their child. I really enjoy the relationships that I've been able to develop with my pediatric patients. A lot of these patients I've known since they were in utero, actually, and to really get to see them grow and see them develop and see all the benefits that we've done for them has really been one of the most rewarding things. I treat all of my patients the way I do if they were my own children. I have 3 young kids, a 5, a 3, and a 1-year-old, and I think one of the most important lessons that I learned in medical school was that if you treat your patients the way you would treat your loved family member, then you can never go wrong. If I try to maintain that thought of what would I do if this were my child, then I think, that hopefully, no matter what decision we make, we're going to be comfortable with it.